Hello, I'm Dr. Tom Groover, and this is Norris Golberg, Dr. Norris Golberg of Koru Chiropractic in Louisville, Colorado. And this is episode 3 of The Big Idea. And in episode 2, we talked about your history and how you got into chiropractic, and how you had shadowed a doctor, and at the end of the day, he treated you, and you had an enormous rush of energy and mental clarity and perceptual expansion of your perceptional experience. And so can you talk about what was the mechanism, what was it that he found that needed to be corrected, and what was the mechanism of that correction? Why all of a sudden did you have this big, enormous rush of wellness?
Sure. So after many years of contact sports, essentially up to that point, probably about 20 years of contact sports and never getting adjusted once in my life, I was very physically fit and well maintained, but never had my spine realigned. And I'm sure because of all those contacts, and especially with football and rugby and hockey, you're just taking a lot of head and neck hits. And as we know now, that's probably wasn't the best thing, but we're here today. I'm not messed up yet. So Dr. J, he adjusted my atlas bone and a lower vertebra in my cervical spine. I would assume probably C5 or C6, but he did a more traditional chiropractic approach where he's just feeling for fixations or restrictions in the spine, and then he did a fairly high velocity big adjustment.
Right.
And it's not what I do in my practice, and is what they teach in school. It's kind of the mainstay chiropractic care these days. I've since evolved, and I feel like I do a much more advanced approach, but I still end up targeting those similar areas, because when we do adjust lower in the neck and the top of the neck, that actually increases blood flow to the brain. That increases CSF flow, or it should help with the circulation of the CSF flow, and it really just gets your neurons firing. And that's shown through research. We see that actually your frontal lobe activation, which has nothing to do with your muscles or your balance, increases by 20% after a chiropractic adjustment, which I think is pretty cool. And I think that's where, felt that almost like the lights brightening, the
Right.
dimmer switch raising. And from right then and there, I just knew like there was something really special to chiropractic care. It wasn't just cracking joints. And he even instilled that in me. He said, this is not just me pushing on the high spots and moving bones. There's a lot more to what we call a subluxation than just hitting the high spots.
Right. So you mentioned that's good, but it's not what you do.
Right.
So can you go on and explain your analysis and your theory of how chiropractic works for you?
Yeah, so when I first got into school, being a rugby player, I got right into the sports chiropractic program, and there was a very similar approach that was being taken, but they also incorporated muscle testing. And with the muscle testing, I loved seeing the changes before and after the adjustment. That really just resonated with me. I felt like it would always resonate with my patients to say, here's a weak muscle, I'm going to do this little adjustment, and then all of a sudden the muscle is strong again. And that's really that connection improving from the brain to the body and back again. What I didn't really like was the adjusting technique and style. It always felt like it was always designed to adjust a huge 250-pound rugby player, and what was I going to do when I had a little 120-pound lady on my table? Was I going to do the same adjustment, or was I going to have something else in my toolbox? Around that same time, I was about a year into chiropractic college, and I did have some serious doubts, like, is this maybe even the right profession for me? Is this as good as I thought it was? It was almost like the honeymoon phase had ended, and I was trying to figure out, well, what is this all about? And of course, there's many things that can distract you in chiropractic care, because we have a pretty broad scope of practice. But what really resonated with me and came back to me was the teaching of Dr. Tom Morrison with his x-ray analysis and being more specific. And he was really the one who instilled, how are you going to measure this? How are you going to show what you're actually doing besides just the noise that the spine may or may not make, right? And as you and I both know, that has nothing to do with success. We can make joints pop, and that doesn't mean anything. They may not pop, and miracles can happen, right? And so at that time, I had a colleague, my friend, Dr. Ty Carzoli. He actually practices down in Denver. He was heavily involved in the Pierce results system. And he had, in the Pierce Result System, they use a specialized type of x-ray, a video x-ray, where we would look under video fluoroscopic imaging and look at people moving their spines. So for example, looking up and down. And that would just pinpoint very crystal clear where the targeted spot was, what vertebra, down to the single vertebra, it needs to be adjusted. So it's not like, oh, you just have a stiff neck, we need to adjust that. It's like, you need your C5 adjusted coming from this direction. And that really resonated with me with my analytical and honestly quite skeptical mindset. And when I started incorporating that approach and using other technologies that we still use in this office today, I more or less fell back in love with chiropractic care again. And I knew it was my mission to help people with specific and gentle adjustments that would realign the spine, but get them the big miracle results that we're looking for and that we talk about with the big idea.
Excellent. So can you go a little bit more into explaining how this approach is distinctly different from the usual approach that chiropractors have when they come out of school?
Yeah, so, there's many forms of chiropractic care. It's over 200 different techniques, probably even more than that now. Many of them are good and they help people, but I do believe that there are some that are great and that just go above and beyond and just much more focused, much more specialized in terms of getting corrections to the spine. So with the more traditional or typical chiropractic care, they're going to go in, they're going to feel for stiff spots, and then adjust it and essentially manipulate it into a position that it feels like it's moving or it's more free. But there's no actual measurement of the nervous system and how things are functioning before or after the adjustment.
Right.
So with my approach, I use two different techniques, the Pierce Result System and NUCA, which stands for the National Upper Cervical Chiropractic Association. And that's the upper cervical technique I do to adjust the top bone of your spine, your atlas bone, which is ultimately the most important bone in your spine, in my belief. If we don't have that aligned, we can adjust every other area of your spine and it could all be for naught. It might not matter at all, because if your head is crooked, if your neck's off at the top, it's going to cause your whole spine to deviate below that, right?
So it's a priority based approach.
Absolutely, yeah.
Highest first, so to speak.
Exactly, yeah. So we really look at it as like, the priority or the layers. I sometimes talk about getting down to the deeper layers and not just focusing on the top surface area where, again, a lot of times you can get big pops and shifts here, but it might not actually neurologically get you to where you need to be when you get to those deeper, more chronic issues that have been there for a longer period of time and might not even be causing you pain, but are certainly contributing to the overall physiological compromise that you have going on in your body. It's causing your symptoms.
So what is the significance of this top bone in your neck then?
Yeah, so as your head sits on your spine, your atlas bone, we call it the atlas bone because it's like the Greek mythological character he was the Titan who held the earth on his back and his shoulders, right? So we've got this big 10 to 12 pound bowling ball of a head that we all have sitting on this tiny little neck, right? And actually it's much smaller on the inside than we see from the outside. So this tiny little bone is about this big and has to support all that weight. So it's also the most movable bone. So it has the most motion. It helps us turn our head left and right and also move up and down. And when that bone is moving like that with this extreme weight, it only takes a little bit of trauma to misalign it, right? Or subluxate it. The reason that one's so important, not just because it's so delicate, but that area is like, I always call it the command control center of your entire body.
Right.
It's really where your brain is connecting to your spinal cord. It's where the blood is going into your brain. It's where the cerebral spinal fluid or CSF is flowing from the brain down to the sacrum and then back up again. So several components there that can happen, also including the spinal cord being connected to the atlas bone via the dentate ligaments. And so there's several mechanisms that we can see physiological compromise when you have an atlas misalignment. So it can actually affect the whole body, not just one area. For example, if you have, like, say, a pinched nerve at L4, you might have some numbness going to the knee. You maybe even have some digestive changes, but that's probably the extent that it's going to bother you. I mean, besides that and extreme pain. If we have a misalignment at the top, it can just really start shutting down the whole body, and we can see dysfunction throughout.
Very good. So I've often heard in my years of chiropractic and work with this top area of the neck as well, is that that is the real subluxation. I mean, it's like the mother lode of all subluxations.
Yeah.
And so in your practice, you set that up as a top priority.
Absolutely.
Yeah.
Yeah, Dr. Pierce, who is the other technique that I practice, the Pierce Results System, he was an upper cervical doctor first, and then he found out that there was other subluxations in the spine that were acquired through traumas.
Right.
And so that's why I'm not only an upper cervical chiropractor, but why I'm not just what we call a full spine or a diversified chiropractor who just really adjusts everything the same way. I use a specialized technique for the top joint in the spine because that's a special shape joint. It requires a special type of analysis and also a special type of adjustment. Versus lower in the spine, it also requires a more thorough analysis and a specialized adjustment to get the right results. But really, as we look at it, we can fix these things from most acute to most chronic and really correctively rehabilitate the health of your spine so you get back to an area of full function.
Excellent. So thank you very much, everyone, for joining us today.